Namaskar and a very warm welcome to this edition of the program Let's Talk Vaccine, question hour on COVID and gastro queries. I'm Nidhi Kumar and you're watching India Science. In this program, we will take your questions live from Facebook and YouTube. So today we're joined by Dr. Nihar Ranjan, physician, surgeon, consultant, surgical gastroenterologist at the All India Institute of Medical Sciences, New Delhi. Many thanks for joining us today. Namaste and welcome to the program, sir.
Namaskar.
I'd like to ask you a very basic question, sir. A lot of viewers want to know how you would like to explain the COVID variant AY.412 and its symptoms.
Basically, if you see the viruses of a particular category, they look alike. Over a period of time, they have a tendency to change their shape and the nature. So there are at present 4 variants which we know. The Delta variant was the most problematic variant that was prevalent during the last pandemic and caused lots of damage. There are further sub-variants of this Delta variant. So if you see the newspapers, the media, you will find lots of discussion about them. This variant was found in Bangalore, that one was found outside in Brazil, like that. So basically, I would suggest not to be confused by all these things, going into all the details, the numbers. The numbers are basically dependent on the certain naming of these viruses in the laboratory. So according to that, the numbers come like this. So like, for example, AY4, AY12 was prevalent in Bangalore, it was found there. So why it is important? Do we need to know as a common man about these variants all the time? So my answer at present would be a big no. Please do not be worried about this. See, what is these variants? They change their characteristics, their presentations, and what we are concerned is how dangerous they are to the society or the human being. The Delta variant is the most contaminating or communicating or penetrating, as they say, among all the variants. And as the time progresses, the virus has a tendency to change itself to adjust to the environment and the therapeutics or the medicines what we are giving and the treatment we are giving. That's why we are seeing many variants. These variants are at present, especially 4 or 5 variants are in the news. 2 of them are internationally and 2 of them in India. So the latest one, what you are discussing, I am not going into the details of the chemical or the genetic nature of the virus. What I want all of us to know is, there are 3 things we should remember. These variants, whether they are more contaminating than the last one. Second, whether they can cause a dangerous pandemic, whether they can cause serious disease or not. Third thing is, whether these variants can defy the vaccine. That is what is important to us. So some of these variants which are now finding in the newspaper, on the news, are fortunately have not proven to be very dangerous for us. Neither they have been proven to bypass the vaccine or resistant to the vaccine that we are taking. So what is the message from this? Take your vaccines, all of you. This is recommended. And as of now, these variants are not really jumped the vaccine. So we can say that we can be immune to these viruses to a great extent. We take our vaccines.
And the possible precautions.
COVID precautions. So whatever it may be, if you take COVID precautions, all these variants are protected.
Absolutely, sir. My next question to you now is, what are the possible complications of gastroenteritis? If you could explain that, since this is particularly your field.
Gastroenteritis, as I say, itis means inflammation. Inflammation, what happens in inflammation is the gastrointestinal system is a tube. Its function is secretion, absorption, and digestion. So, what happens is when there is inflammation, there is a problem with these three processes. So, how does the digestion and assimilation occurs in our intestine? When you take food, there are enzymes, there are secretions poured into the lumen of the bowel to make a mixture of the food and help them in digestion, breaking down, and assimilation. If there is itis, means inflammation, which you say gastro means stomach, enteritis means intestine. So there is inflammation of the stomach or intestine, and then what happens is the bowel becomes, wherever you see inflammation in the body, in the skin, as we can see, they become swollen, they become edematous, red. That's exactly happens to the GI tract also. So there is lots of secretion into the GI tract, so the GI tracts become painful and the patient passes lots of loose stools. So why does it happen? Any irritant thing, if you ingest inside, that can cause inflammation. Like any irritant thing you apply to the skin becomes red and inflamed. So that irritant could be classified into many. It could be pathogens like bacteria, viruses like that. It could be foreign bodies, it could be chemicals, it could be drugs, you name it, it could be part of generalized inflammation. So if we get loose motions, pain in the abdomen, with or without fever, these are the three signs of inflammation of the gastrointestinal tract, and with or without vomiting. So we say the patient is suffering from gastritis, gastroenteritis. If it is within 2 or 3 days or within a week, we say it is a acute one. If it is more than that, such as 6 weeks or even months, we say chronic. So we have to find out what was the problem. Most common thing in our society is with the food. So we ask the patient whether you have taken something outside or not. Most of them would say that there is something wrong with the food intake. So that was the first thing we have to explore. Then we have to ask them what other irritant things they have ingested or they are suffering from. So if it is happening like that, the patient is passing lots of fluid, lots of electrolytes from the body. Our body is very sensitive to loss of electrolytes like sodium, potassium, chloride, etc., and water. 70% of our body is water. So if it is reduced, the blood becomes less thin, and it is not good for our body. So we have to replace them. The simplest form of management of these things is replacement. Water, electrolytes, ORS powder is there. Don't get panicked. Just day one, day two, start this and then see what is happening. You may consult a physician on day one itself, no problem. But if you are confident enough, see how the patient is behaving. If the patient is fine, is taking orally, and you can supplement the fluid, whatever is passing. You can wait for 1 or 2 days. Once this toxin things passes out, the patient becomes fine. If it continues more than 2 days or the patient becomes very weak, the non-responsive type, lethargic, then you should think that there is something I'm unable to replace the patient what is losing. So in that case, you have to inform a hospital or a nearby physician. So sometimes vomiting is associated with loose motions. Even if you give orally, that doesn't help. So if you consult a physician, give some medicines, it may stop. Still, you can manage. Basically, what happens is do not be panicked if you have a gastroenteritis. Most important thing is whenever there is a diarrhea, people stop taking food and they start taking restricting everything, taking some fruits, vegetables, all sorts of things which they do not take normally. Thing is, take things which you are taking normally. That is the
Absolutely.
basic thing of management.
We're joined by first caller, Rashi Agarwal joins us from Delhi. Yes, please ask your question.
The question is, what is obstructive jaundice and how it is treated?
See, sorry, I couldn't hear your name. But anyway, jaundice, what is jaundice? Jaundice is increase in the jaundice parameters in the blood. What are the jaundice parameters? Normally, our blood cells over a period of 70 to 120 days, that is their lifespan maximum. The RBCs, red blood corpuscles, they get damaged after their lifespan and get degraded. The hemoglobin inside that gets degraded to form a substance called bilirubin. The bilirubin is a yellow pigment. So bilirubin has further salts, and we have bile. Bile means जिसको पित्त कहते हैं. The bile contains bilirubin, the bile salts, the bile acids, water. All these things mix up, and this bile is normally formed in our body to aid in digestion, fat digestion, and absorption of the fat soluble vitamins. So how does it go to the intestine? It is formed in the liver. From the liver through a bile duct, it goes to the duodenum, which is a part of the intestine, comes after the stomach. And then once we take food, that mixes with that and causes digestion. In the middle part, whenever we are not eating anything, the bile is stored in a pouch that is called gallbladder. So whenever the bile flow is not continuous or obstructed on the way, the bile refluxes back into the blood. The bilirubin gets increased, the bilirubin salts gets increased, and you get a yellow coloration of the eye or the skin or the mucosa. So that's what we call jaundice. Normal, it is 0.8 to 0.2 to 0.8. Beyond that, it starts accumulating. If it goes more than 2, we start noticing yellow color. 2 to 3. If the skin looks yellow color, it is 6. So these jaundice could be because of many causes. You asked about obstructive jaundice. Obstructive jaundice occurs when the bile flow is obstructed. How it will get obstructed? Either it gets obstructed by a stone, or it is by a tumor, or many other causes. So whenever that occurs, the jaundice goes on increasing. What are the symptoms? One is the person will look yellow. Second thing is, because of the presence of these bile salts, they are irritant to our skin. So the patient gets itching, severe itching, and the patient can't even sleep. And because of a stagnant bile, the bile is a very constant source of infection. There are normally bacteria in the bile. And when you obstruct the flow, the bacteria go on flourishing, and the patient gets inflammation of the bile ducts. So that is what is called cholangitis. Chola means bile ducts. Inflammation of the bile duct would be cholangitis. These are common terms you will be finding in the doctor's prescription. So if a patient has jaundice, has severe itching, and has recurrent attacks of fever or pain abdomen because of the inflammation, the patient is possibly suffering from obstructive jaundice. If it's an elderly person and having loss of appetite, always suspect that there could be a case of malignancy on the way. And otherwise, in younger people, it can occur because of the stones which have slipped out from the gallbladder and blocked the bile duct.
Absolutely, doctor. Thank you so much for explaining this and such insight. I'd like to now ask you, what is liver cirrhosis? There's a question on our YouTube. What are the main symptoms of this? And asking this is Nitin. When should one contact the doctor in case of liver cirrhosis? As we're seeing a lot of cases with liver problems after long COVID or post-COVID, as we may call it, sir.
Liver has many functions in our body. It is the energy storehouse. It takes parts in many metabolism in the body. So it is a very soft structure, not as spongy as the lungs, but it is just soft structure. So what happens if you harm the liver by introducing irritant substances which pass through the liver, comes in contact with liver, the liver revolts. It gets inflamed. time and again it gets inflamed. And when it gets inflamed, that's a natural process in our body. Whichever part in our body gets injured or inflamed, the body starts healing it by forming fibers to seal that area, to heal that area. That is called fibrosis. So when there is repeated inflammation of the liver because of causes which have come later on, so the liver tries to heal itself, or the body tries to heal the liver with fibers. The fibers are thin rope-like structures. So you imagine there is a soft structure. You must have seen livers of many animals also. It's a soft structure. When there is fibers inside, they go on increasing in number and size. The liver becomes harder, harder, and harder. So ultimately, the liver becomes hard. Wherever there is fibrosis in the liver, that part of the liver is non-functional because there is no liver tissue there. So gradually the fibrosis tries to cover the entire part of the liver. To compensate this, the liver tries to regenerate at places. Wherever the liver tissue is there, the liver tissue tries to proliferate, increase in number to compensate for this fibrosis. Unfortunately, that's not sufficient. So what will happen? In between fibrous tissue, the liver will pop up like nodules. So these are we call regenerative nodules. So when is the liver is hard with nodular thing, we call it is a case of cirrhosis. So cirrhosis means fibrosis with regenerating nodules, and fibrosis is simple liver fibrosis. So liver fibrosis at times can be reversed, but cirrhosis is you can't reverse that one. Well, normally, our liver can sustain our life even if it is damaged up to 80%. Some say 90%, I would say to be on the safer side, 80%. There's 20%, if it is working, it can still sustain the life. But ultimately, it fails to cope up with the body metabolic demands, and it goes into failure. It goes into failure means liver cannot do its metabolic functions. It cannot do its synthetic functions. It cannot do its detoxic functions. Liver synthesizes albumin, which is a very important protein for us. That will not be synthesized. It cannot detoxify ammonia, which is detoxified in liver to form urea. So the ammonia level goes up. And lots of metabolic functions are deranged. So what will happen? Because of this, it is a storehouse of the energy that's not done. The patient becomes lethargic, becomes very weak. Non-specific weakness is usually the commonest thing that occurs in cirrhosis. There are there's a huge, large spectrum of things that can occur in cirrhosis. Basic problems are inability to manage with your routine activities. The patient becomes weak, lethargic, lean and thin, the muscle mass becomes wasted, ability to fight resistance becomes less, gets frequent infections. And when the toxins levels like ammonia becomes high, it affects the brain. The patient becomes confused, goes into pre-comatose comatose stage, and he can become comatose. That we call encephalopathy, means involvement of the brain because of the cirrhosis.
Absolutely, sir.
Because there is another very important thing is the liver, when it becomes hard, the blood that is passing through the liver, normally all the blood from the gastrointestinal tract, they pass through the liver to the heart. When it is hard, there is a great resistance to this blood flow. And because of that, the blood vessels of the small bowel, they become very turgid, big. So that is a condition we say it is a portal hypertension. So in that case, when they become too much dilated, they can burst and cause hematemesis. Hematemesis means bloody vomiting. So that is one of the common causes of cirrhosis of the liver when the patient has portal hypertension.
Yes, sir.
It's a huge subject. These are the basic thing. If the patient is Suppose alcoholic for a long time and the patient has developed hematemesis, then you must think that possibly the liver has got cirrhosed.
I would
Similarly,
like
the
to.
viral diseases. Yes, please.
I would like to ask you here, what are those immunity building foods that possibly people can have to kind of, take care of their liver and protect it, since it's such an important organ? I think this part of this also needs to be highlighted by you, that you're telling us.
The only one thing which liver needs from you is glucose, which is a good thing for the liver. And the second thing, there is actually no such increasing boosting food that would make your liver perfect or that would recover the liver from its assaults. No such. It's the same thing happening to the entire organ or system of the body. What is required is prevention. Just prevent the harming substances. If you're taking alcohol, stop it. If you're having jaundice because of the hepatitis viruses, treat it as early as possible. If you're taking some drugs that is hampering your liver, stop it. So it's nothing that if I take certain things and my liver will become very strong. No, that is one. The second thing which is now coming up and that is most important, everybody should know, is non-alcoholic fatty disease. Even if we are not taking alcohol, our liver is becoming bad. The commonest cause for that, which is harming the liver, is fat. So if we're taking our visceral fat, abdominal fat, if we're not controlling our fat and we are accumulating fat in the abdomen, it harms the liver and it can cause cirrhosis. And it is in fact one of the most common causes of cirrhosis now. So how do you prevent that? Normally what happens, what we used to see that the patients, for some cause, they go to the clinic and they say that, sir, I am having some digestive problem like that, and the person gets an ultrasound, it shows a fatty liver, and they get panicked. My liver has lots of fat, what will happen? Then they have said, yes, it will go on to become cirrhosis. Yes or no? It may. So what you have to do is simply you have to do exercise regularly. We have to reduce your fat. Just do these two things, your liver will become okay. Your liver will remain all right. And don't take any harmful substances for the liver. You must know what are the substances they are harming the liver. That's all.
Absolutely.
And no food can cure a liver.
Right, sir. A lot of people are asking us about acid reflux or GERD. Is it heartburn? It sounds like there's a lot more to it.
You have to understand the anatomy a little bit before going into that. Our digestive system starts from the pharynx, and then it becomes a food pipe, which is esophagus, goes into the abdomen. From the thorax to the abdomen, it becomes the stomach, a pouch-like thing, which stores the food. So, what is the function? When we take food, by the help of peristalsis, means muscle movements in the esophagus, it goes down into the stomach and similarly further down below. If there is no control, so if you go on taking food, there is a chance that the food will come back to our mouth. So how that will be controlled? The food goes on with peristalsis down below, and there are checkpoints which prevent the food from getting back while it is being pumped into the stomach. Similarly, when the stomach will pump the food down, some of them will come up into the esophagus. So that is being checked at multiple checkpoints. The two most important checkpoints, one is here, there is a sphincter. Sphincter means thickened muscle which goes into contraction when there is chance of reflux. Similarly, second thing is near the esophagogastric junction, near the diaphragm. So if the stomach pushes food into the intestine, the reflux is prevented by the pinch cock action. All the all the clippage action of the sphincter near the esophagogastric junction. Now, if this sphincter is loose because of some causes, when the stomach will contract, the food will regurgitate back and it can even come to the mouth. Now, how does that occur? Sometimes these sphincters can be defective or the function could be hampered because of many causes. It could be because of a neurogenic, the psychological causes. It could be because of body structures, because of malignancy, so many things. Please don't go into it. Please don't read the internet and thinking that you are having this thing. This could be normally occurring also, or this could be abnormally occurring. Now, what are the most important factors you should discuss? Number one is obesity. What happens in obesity? The fat gets deposited here. If you take, and that weakens the sphincter. The muscle, if fat enters into the muscle fibers, the muscle becomes weaker. If we're taking food in a very huge quantity at a time, what happens because of our lifestyle, we used to take a lot of food at night and throughout the day, we manage with less amount of food. Some of us, I'm saying. So imagine if the stomach gets very distended with food, this sphincter also gets opened up. So when the stomach contracts, the food regurgitates up. What will happen? The stomach contains acid. The acid helps in digestion and other functions are there. So acid makes food, goes up into the esophagus and comes in touch with the esophagus inner lining, that is called mucosa. And this is very harmful to the mucosa. So the mucosa gets inflamed. When it gets inflamed, you get burning type of pain. Acid, if I touch acid to the skin, how it would feel like burning. So you get a burning type of pain. You can even get regurgitated food into the mouth and you can get burning here. You can get pharyngitis. So in fact, in many people, when they complain of recurrent pharyngeal or throat infection, one of the things we ask about the reflux. If you treat the reflux in them, sometimes they get rid of this.
All right.
What this reflux can do in due course, chronic inflammation will lead to precancerous condition and then cancer. So there is a definite risk of that. It depends upon what is the grade and type of reflux that is occurring. So if we are having this, then what to manage? First, change your lifestyle. Small frequent foods. Do not mix food with water. Give a little bit of gap. And then chew it well and do not lie down immediately after taking food. After supper, walk a mile, all of you know. So just sit up a little bit, walk around after your lunch or dinner. It's a very good practice if you walk around for 15 minutes after your dinner or lunch. And divide your food to 4 fractions. So that is a way. And don't keep your stomach always empty, completely empty. Take sips of water. You have to take 4 to 5 glasses of 5 liters of water a day. So keep them in a bottle on a table. This is now the most important problem in this lifestyle. What we are maintaining is lack of water. Keep on your table 4 liters of water. See that they are finished by night. Or 3 liters of water, 1 liter of other fluid.
Absolutely,
so take water regularly. That's a very good thing, very good habit that you can inculcate.
Another question that I'd like to ask you, and probably this would be the last one since we're running out of time. Most people are complaining about blood in urination after COVID symptoms, or, after the second wave, since they had COVID. These kind of queries are coming up. Could you please explain the causes? What should they check up? Because they meaninglessly go to the net and then come up with all kind of solutions. What exactly is the problem if this happens, and who should they consult?
First, let me be very clear about this internet business. My sincere, humble request to all of you: please do not read the internet and diagnose and treat yourself. Please, you you can have a basic idea about the thing, but do not relate or correlate those things which are in the internet with your symptom or signs. That is most important. Second thing is, after this COVID, is what is called long COVID. There's a long-term sequelae of the COVID. Almost all the organs of the body has been shown to be affected. Like for example, in liver, we see the liver enzymes getting changed, but they ultimately come back to normal. So what you are asking is bloody urine. Bloody urine, it's a very specific thing. Sometimes the urine looks very deep yellow and people think it is blood. So don't think that bloody urine, what you are assuming is actually blood. When you suspect a bloody urine, maybe after COVID or not after COVID, it may so happen that you had a urinary problem which is causing blood to pass into through the urine, that may not be connected to COVID. It has become a tendency to connect everything to COVID if you have suffered from COVID. No, you just go by the symptoms. So if there is blood in urine, or the urine looks really bright red blood, or if you keep the urine in a bottle, you see the sediments, reddish white sediments settling down, there's something wrong in that. The first and simple thing is just send a urine for a routine microscopy. If the routine is normal, don't worry at all. But sometimes with your prescription, they don't do urine test. So just ask a physician and get your urine checked. That's the basic thing that is required. If the urine shows blood, then obviously the urinary tract, which starts from the kidney, then the kidney tubes, the ureters, the bladder, the urethra, anywhere there could be inflammation, there could be injury, there could be stones. All this could be the possibilities. Then leave it to the physician to think. First establish whether it is blood in urine or not. Sometimes certain foods also, certain drugs which are coated with coloring agents, they can cause the urine to look yellow or reddish also.
Well, thank you so much for that insight. And in the end, I'd like to thank you, Dr. Nihar Ranjan ji, for joining us today. And with this, friends, this is the wrap on this edition of Question Hour. Stay safe, stay healthy. Remember to keep your liver healthy. On that note, many thanks for watching. Namaskar.